This small piece is to discuss the various problems being faced by the medical profession throughout the world in the control of COVID 19 infection. One of the very fundamental reasons for high mortality in COVID 19 and the difficulty in control of COVID 19 and the way it has spread all over the world is that the health profession, particularly the administrative part, the financial part, the policy part, is not really now controlled by the doctors' community. Most of it is controlled by either autocratic regimes, or it is controlled by the politicians, or it is controlled by the non-medical administrators. This is of crucial importance because COVID is a very fast disease. It's not. Its spread is of such a kind that it is not really possible to follow the usual format whereby the medical profession would be there as advisors and they will advise some of the politicians and civil servants, and civil servants will think about it and the paper will move up and down, in the numerous bureaucratic channels, and then a decision will be made regarding anything, whether it is regarding treatment, regarding vaccination policy, regarding the lockdowns, or regarding anything else. This is a number one problem. I personally feel that the international casualty figure of COVID, as well as the number of patients, would not have been more than 30% of what they are had the doctors got the administrative, financial, and the policy control of COVID in entirety. Second problem which has been faced belongs to within the medical community. The problem here is that traditionally it is the public health doctors who handle the policy decisions regarding health of the countries within the medical profession, and it is the Western world is obviously very benefited by a lot of PhDs doing research and giving advice and so on. But in the case of COVID, this has got a very peculiar type of issue. COVID has got a lot of clinical effects and clinical manifestations, and it is a fast disease. The problem with COVID is that and it's mainly respiratory spread, the main problem with COVID is that somehow this model of COVID spread and the COVID itself is not very suitable. That's the decisions are made by the public health doctors. It has got a very strong clinical tilt in it, and the best group which one can gather is a combination of internal medicine physicians, pulmonologists, infectious disease consultants, virologists, and immunologists, and but people, cardiologists, neurologists, and nephrologists. You see, the people who are more concerned with clinical medicine rather than just the labs and laboratory medicine. One of the stumbling block has been certain disagreement very early on in the COVID, whether this is a virus or not, or whether this is this thing or not, or whether there is a proof whether the mask will work or not. Now, that is very strange, because in clinical medicine it is quite well known that once a infective origin is proved by various means, sometimes we take the measures to prevent spread of infection, and even it is sometimes possible by studying the pathological specimens whether something is of this type or that type, or body's response you see, and you can institute even treatment without actually isolating the exact organisms. And this has happened many times, that exact organism has been identified later, and things have their management, clinical management, has started earlier and sometimes successfully. So this this controversy, whether it is a virus or not, it is proven or not, uh, that may be of interest to a PhD person um, with such expertise, but it is not so much of interest for the clinicians, because certain things are laid out that these in very early on in the 1800s, that diseases follow such and such pattern and such reactions and such a type of things are helpful in such things. That also has confused the people. Uh, the third basic problem is that on the face of it, and it has been proven in the COVID epidemic, we don't have a pan-word, truly scientific, not political influenced international body. Some would say that this is the WHO. I would beg to disagree with that, because WHO, if you study it closely, the way it is run, its regional offices, and so on, you will find out that WHO is amenable to a lot of political pressures, and it is, for example, the regional conferences, the Director General Health will go and things like that, and they are not always clinicians, they are not always health ministers are not always doctors, and so on. And then there is obviously the issue of elections from time to time, and there's the African lobby, and there is the European lobby, and there's the third world lobby, Chinese lobby, and so on. And that is why the decisions of the WHO need not be that much neutral, and so on. And second thing is, WHO is mostly an advisory body. It's a coordinating body, well and good. It's a very good body. It's a very effective body in many things. But the problem is that when it comes to high science, when there's a conflict between science and the commercial interests, WHO has got a structure which is influenced by the respective governments and their policies. Is not a true scientific body, and it is not a epic scientific body either. This must be understood. If you see the people who are working in the WHO, most of them would be public health consultants or things like that. You will see very few clinical people in World Health Organization, or very that type of thing, although they have got a very good coordinating network. And it is for this reason that there was criticism early on that the WHO did not inform the world very quickly, and maybe its Secretary General was influenced by political considerations or re-election or whatever, or they would not show that such a reaction is needed. But that was just the beginning. Later on, many countries who could have stopped this thing coming from their country, in order to encourage economy, they did not do all the preventive measures. There are certain states who had zero tolerance for this type of thing, and they succeeded in stopping COVID in their lands, and for quite a long time, some of them almost 6 months, 1 year, or something like that, till very infectious variants started to develop. And even now, there are countries who have got a low incidence of COVID-19 because of the policies or because of certain other things. COVID-19, from its being a respiratory illness, it was very surprising that some would say that the mask would not be useful, or that thing would not be that much and 2% effective and this percent effective. Now, this is against the observation that for the last 100 years or more, the doctor's profession, who deal with all kinds of infections, before these treatment came, they used to wear the hospital masks, they used to wear the caps and gowns and everything, and they live up to old age. And this is the biggest proof that they have lived for generations to old age in front of so many emerging and new diseases and so on, and most of them they lived. So these were effective measures. There's no need to discuss them that they are not. In fact, the emphasis should have been focused on this thing that how can you have a comfortable mask and so on. Even today, in front of serious variants, how many hospitals in the world have got astronaut sort of helmet with the rebreathing filter or oxygen supply or something like that for any doctor who might not be that fit to take on such care of such patients and so on? We don't have. The next factor, which is very problematic, is that it is established thing that good ventilation is a very, very important thing in any disease which has got a respiratory way of spread. This is very well known. If you go to Europe or something, you will always see that the hospitals used to be, very long corridors. There was always a window on the side of the bed, and through which the sun can come and air can come and so on. And the idea behind this was that these were respiratory illnesses, and obviously the distancing of the beds, the ventilation was important, and this was, this thing has been known for centuries, not just last 100 years or so, that a good air is needed, and there is something called bad air from the point of view of the disease. One of the unfortunate things happened is because of larger cities, there has been a change in the designs of the hospitals. Hospitals are now very compact places, and they are multi-storied, and they are basically, their designs sometimes they are not suitable for a respiratory epidemic. This is one of the reasons that the doctors, they suffered so much, because the hospital designs, hospital ventilation systems in many parts of the world are not suitable for a major respiratory serious illness. And then, there is this reluctance on the part of the people to wear masks, and there is no effort to put exhaust fans where such can be extremely helpful in preventing the room to develop a very high level of virus and things like that. This has not happened. For example, in Pakistan, from which this video is originating, the business establishments are of three basic types. One is usually a small shop which does not have very nice any doors to enter or something. It's just an open, half the merchandise is in the shop, half is lying out. And in such places where there is in addition some exhaust fan behind, and there is usual fan there also which should be suitably placed, these places theoretically would not be very likely to be the places where the COVID will spread. And yet, we order these shops to close very early in the evening and so on. On the other hand, in the supermarkets, which are closed, and their ventilation systems are sometimes not working, and they don't seem to have special filters, and these are very, very suitable places for getting infection, and especially when people stand in queue for the payment of the bill, and masks, they are better in stopping from the front rather than the something which is coming from behind your ear, by the person next. And interestingly, these things are allowed to open till 11 o'clock or 1 a.m. at the night, which is just the opposite of what should be. Then obviously the multi-storied the offices, they obviously need ventilation system, the courts, and all places of public gathering. Exhaust fans are very important. There have been studies where the combination of mask and exhaust fans have been almost 40-50% effective in stopping, in preventing the COVID infection, which is almost the same as the efficacy of some of the less performing vaccines against the various variants, which is almost the same. And it has got additional protective effect in the sense that if such things are done, it will prevent against other respiratory diseases like common cold, tuberculosis, and it will benefit the humanity further. And besides, it takes time to identify any new variant or something. It takes at least 5, 6, 7 weeks before it becomes international that such and such variant is, or such are its characteristics. So if we have a combination of masks and ventilators, we are much better placed against those things which might come again. We don't know about that. Another issue which is important is the public interest in discarding the masks. We have got a very good example in the case of Mr. Trump and his associates, who are still insistent that this is some kind of personal freedom or something like that, like vaccination. I would say that mask is not that much of a personal freedom, but vaccine, yes, vaccine cannot be given to everybody, and it's not safe for everybody, and it is a bit important not to force vaccination on each and everybody. Because we basically can spare a small percentage of 10-15% people from vaccination because of the phenomenon of herd immunity, which can protect all even if everybody is not immune. One of the basic flaws in which the COVID has spread again and again, and it has helped in the spread of various versions, whether it was the Kent version or the Indian version in Pakistan, for instance, and that is to insist on opening of educational institutions for commercial benefit. This is absolutely, we have seen when that in any city, when a new variant comes and it is infecting, let's say, 3-4% of the people, and if you keep the educational institutions open, that means it will just take 6 to 8 weeks for it to develop into a proper pandemic. The reason is that the schools in the developing countries, they have got small classrooms. The children, as you know, they are very fond of each other and they do close contact, and there are no ventilations, there are no exhaust fans, and these children would be a great source of spread, and they are a great source of spread. And then, the various types of things are put up in the media. Well, these have got very low mortality there's nothing wrong with that. And we have seen that the 3 biggest sources which we have seen which causes COVID spread, 3-4 biggest sources, is a person in the family with the COVID already, a person who is fond of going to marriages, a person who has got some young children going to school regularly and infecting the grandmas and so on, and so on. And certain countries have not put in, even now, there are certain medicines and certain things which have proved to be useful. One is the extracorporeal membranous oxygen machine, ECMO machine, and I've seen people who have been saved by ECMO machine, and then there are certain medicines which are being tried, like baricitinib, Janus kinase inhibitors, tocilizumab, remdesivir, and there are about 4 or 5 others also which have been shown in various trials to be of some degree of benefit. And these are not universally available. Nobody has tried to register them internationally. Nobody has removed their patent rights, which was very important because this is needed for the international manufacturing of some of these things. With this, having said all this, uh, we find out other impediments. Although the medical profession was very nice, that international journals, whichever they were very, very respondent. Most of the international medical journals, they even in 2020, they realized the extent of the problem, and even online they made all their articles regarding COVID free of any copyrights, and you could have them free, and they even published those which were not really peer reviewed, because they tried very well. Medical profession has suffered very heavy casualties, very heavy disease, very, and lots of people have died. I think even in Pakistan, it was the 10th ENT surgeon which died, and there are others quite a bit, and there are many other deaths which are actually related to COVID which are not recorded. What governments have done? Governments have generally hid the figures, which was very damaging, because the doctors often need to know that if a certain variant is spreading, it helps them in understanding, because sometimes there is a small difference between various variants and response, and what should a doctor do. But the states have tried to hide it. States have not bothered to have laboratories. It is about 1.5 years now to have good labs where we can test the variants, or we can test everything. And in third world countries, even though it is true that these are not developed countries, but they still have quite a complement of doctors who can understand the thing. The figures, from a technical point of view, management point of view, treatment point of view, response point of view, are not scientifically available, and nobody has done any effort to do that. Rather, what is happening is, say in Pakistan, somebody who is not a doctor comes, from behalf of so-called NCOC, some command center, and he is not a doctor, and he makes certain policies and something, and he assures the traders that this thing will not happen, that lockdown will not happen, or so on. There's nobody to really explain from a scientific point of view what needs to be done or whatever, and so on. Thankfully, even the vaccination campaign in Pakistan is about 3 months behind what it could have been. And then, sometimes when a new variant comes, we have to close the border of Iran, and we have to close the borders from Afghanistan, and we have to close the flights. But there's a vested interest which is not interested in that, and that's very strong, and we do it a bit late when the thing is already has poured in, and then we get a pandemic, and then there's this thing, that thing. That is the basic problem of not having a medical control of COVID. Now, in future, three things we are expecting. I think the 9 out of 10 chance is that with this worldwide vaccination drives, and which are going on in every country, even Pakistan mercifully is about vaccinating 500,000 to 1 million a day, which is rather good. Whether the vaccines are that effective or not, we don't know. But anyway, the thing is that we expect 9 out of 10 that by the December, January, because of vaccination, the epidemic will loosen a bit. But there is a 5% chance, there is 1 to 2% chance, there is a 10% chance, or whatever percentage you might ascribe to, is that a variant will come which can skip the vaccines. Now, this is very, very dangerous, because if a variant comes which skips the vaccine, and this is the attitude of people not wearing masks, and this is the attitude of people not putting on the exhaust fans in the room, and if this is the attitude of people of holding all types of rallies and elections and opening the schools and so on during the pandemic, then I am very sorry that it will actually end into a real trouble, and especially if the new variant has got a higher mortality rate than the current Kent or Delta or something like that. And since the decision making is always political, for example, in recent Afghanistan, some people, 9-10,000, had to be evacuated, whether they were tested for Lambda version or Mexican version or Peruvian version or South African version or Brazilian version or anything. I don't know whether anybody bothered to do that in the hurry. But the basic issue is that if the COVID-19 versions develop a high mortality rate, some new variants, then I'm very sorry. Then with this attitude, not only there will be lockdowns, there will be lockdown in every street of the world, and there will be a complete collapse. Already figures of deaths, whether they are from India, in certain places we come to know, no, the death rate was 3 times more, certain places 9 times more, or probably the same is in Pakistan as I see, and the many of the deaths which are related to COVID are not regarded as COVID, and there's an effort to reduce the alarm in the people. And in the beginning there was this advertisement that don't be afraid of COVID, we have to fight COVID, and that gives a very wrong impression. One of the problems is that among the religious communities of the world, there is this thing, a sense of preordination, that not if life has to end, it has to end, like that. But the question is that even from the Muslim point of view, for example, it is written in the Holy Quran that when you are in war, the enemies cannot take you by surprise, you can offer your prayers in turn. And there is also a reference to the Prophet's companion and Sahaba of getting treatment from the doctors and so on. This is against the Islamic teaching, because, when a doctor treats you, it's a greater manifestation of the glory of God, because that basically means that the God created a doctor, then he put developed his intelligence, and then he put all the kind of minerals and chemicals in the world which are manufactured by somebody else, and then that works. And it's a greater manifestation of God to get well by being treated, rather than you don't get it at all. So this is very misleading, and this doesn't stand for just one Islamic faith. That stands for also the other Abrahamic faiths, and that stands for many other belief systems of the world. So my message is that take COVID seriously, wear mask, put exhaust fans in the room. When the pandemic, the incidence, it increases positivity in a country, try to increase the testing and also close the educational institutions, the marriage halls, and advise people to be, and not only advise, but also make it mandatory that they maintain distance for a period of time. And the second message is that all countries of the world, for whatever medication which have been useful, the patency should be foregone, and they should be registered automatically all over the world. So even if everybody cannot afford it, the affording people can import it, whatever. And a certain international money should be available for these types of importations on subsidy. Third thing is that even though the ECMO machines cannot help a very large number of people, but still there can be cheap ECMO machines. There have been older models, although this is not something which can be done on a great scale. Regarding vaccination, the interesting thing is that the various Chinese vaccines, their data, most of the trials have been done in countries which don't have a very good reporting system, and they have friendly governments, and we really don't know their safety profile. On the other hand, the Western vaccines, they have been under close scrutiny, and now we have got the problem about the clotting in AstraZeneca. We have reports, messenger RNA vaccines, myocarditis, and some neurological intensifications. Same with the Johnson vaccine, that type of thing, and the adenovirus vaccines and so on. Because we know too much data about it, so we sometimes get scared, even though that might occur in a very small percentage of people. On the other hand, the various types of Chinese vaccines, and there has been comparison, and in the normal state of affair, it has been proven that the Western vaccines in normal situations, not very special variants, is superior to the Chinese vaccine. But in front of the variants of various types, the bad variants, it appears that the various vaccines, there is not much difference between them, and that all the vaccines help in the mortality, which is a World Health Organization finding also. Now, the remaining thing is that would it be advisable to vaccinate very young people, because this is a growing age, and should we come under pressure? Now, the interesting thing is that in certain Western countries, they are thinking of opening the schools, and they do open the schools because they have already vaccinated 50-60% people, and they feel that there is low mortality among children. Then why not bring them forth? And if they get some natural immunity, we might reach the figure of 80% immunity while we continue with additional vaccination drives, and we might reach the herd immunity level. Interestingly, monkeying this trend in the third world, people are opening the schools where their population does not have vaccination beyond 10-15% level, and their natural immunity level may be in about 15-20 more, and they are about 40% immune or 35% or something like that, and they have a huge 40% there to climb, and the only thing they will get is to get their children infected and sick, and particularly when there is a issue of effect of COVID on the brain, on the other things, and various heart and long-term manifestations, many of which are not known. So I think it's not very good, and we should first resolve the issue of ventilation. We have to resolve the issue of the comfortable masks, and we have to try to get more of the adult population vaccinated to reach the herd immunity, and we should think of vaccinating the girls above the age of about 15 or 14 as they mature early, and men above the age of about 17 more seriously. Although it is very likely that vaccination of 12-year-old or even younger than 12-year-old is likely to probably get going in about 6 months' time in most countries of the world. With this, I end this presentation with the hope that it will get some sympathetic hearing, and we modify our policies and attitudes in this regard.